we need to release this lateral pterygoid. How do you do it? Intraoral. So this muscle's kind of tough to get to, right? So before we continue, either grab yourself a glove or wash your hands, right? Sing that birthday song twice. Get a nice soapy lather. We don't want to share germs with ourselves from others. So once you come on back, what I want you to do, there's two ways that you can do this. You can either use your pinky or you can use your pointer finger. I think that I have a little bit more control with my pointer finger, although some people do use their pinky because it is such a small space up there. All right, so what you're going to do is you're going to put your nail portion towards your teeth, right? And you're going to go all the way back past your molars, and you're going to go up high, right? As high as you can get it. It's going to get tender up there. I'm not going to lie to you. It's very uncomfortable. That, once you're uncomfortable and once it's pretty tender, light bulb, you know you're in the right spot, because this muscle is likely irritated. Again, it is not a muscle that, it is a muscle that is very involved in opening and closing. So either way you look at it, we move our jaw over 3,000 times a day. Your pterygoid needs a little love. So I'm going to demonstrate. What you're going to do is you're going to stick your finger up. You're going to find that tender spot. Okay? And you're going to apply a, so I'm up, I'm back, and I'm applying pressure through the pads of my fingers. A medium to firm pressure. Do not bruise yourself. Do not bring tears to your eyes. You want to just create a hurt so good sensation. You're going to hold this for 10 to 15 seconds. All right? And then we will reposition to go to another angle of that lateral pterygoid. Okay? Once you're done with your 10 to 15 seconds, you can move your finger upward along your maxilla, right? Along that gum line, okay? It's still going to feel tender. All of that area up in here is going to be that lateral pterygoid area. You want to do this 1 to 2 times a day, 10 to 15 seconds, and you can do it in 3 or 4 different angles, right? So if you were to take your pinky, I'll demonstrate. If you're going to do your left side, I use my right pinky. And again, I use my right finger, pointer finger, if I'm going to do my left side. So I'll do it with my pinky. Nail towards me, right? Press and hold. You do not want your teeth to touch, and you want to close slightly as you're applying pressure. You may angle it a little differently along this area here. You will feel that tenderness, okay? You should feel relief pretty quickly. But again, depending on the intensity of how tight this muscle is and how irritated this muscle is, you may want to go talk to a specialist about getting it released. It may need some intramuscular dry needling. However, you want to only get that done through a dry needling certified specialist. Until next time, everybody, happy releasing of the lateral pterygoid.
Like and follow for more updates.